250,000 deaths in 1 year. COVID-19.
O vírus chegou, está sendo enfrentado por nós e brevemente passará.
With an excellent track record on vaccination, tobacco control and HIV, Brazil has been known for responding well to public health crises. Until now. In an exclusive interview, CGTN spoke with Sao Paulo's governor, João Dória, who's at the forefront of Brazil's COVID-19 vaccination effort.
We invest in a new vaccine with Institute Butantan and Sinovac, a private laboratory based in Beijing, China. Since March of last year, and beginning in April, we started the program to produce vaccines in a laboratory in China. And then 6 months after that, we had the Butantan and Sinovac vaccine called CoronaVac.
Brazil started 2021 with almost 8 million confirmed COVID-19 cases, the second only to the United States in number of deaths. In January, Brazil's health authorities approved 2 COVID-19 vaccines for emergency use, the Oxford AstraZeneca and the CoronaVac. Minutes after the announcement, nurse Mônica Calazans received her shot in Sao Paulo, the first in the country.
Vamos nos vacinar, não tenham medo. É isso que nós estamos precisando.
Hoje é o dia V.
For Governor Dória, it was Victory Day.
Neste instante,
Brazil's Health Minister Eduardo Pazuello accused Dória of engaging in a marketing ploy.
Ou numa jogada de marketing.
Pazuello had hoped that São Paulo would hold off the vaccination until all the other states had received their doses, 3 days later.
Sobre golpes de marketing, eu respondo que o governo federal já há 11 meses faz golpes de morte contra os brasileiros.
How did the country get here?
O paciente chegou.
The first coronavirus infection in Brazil was diagnosed on February 26, 2020.
He's doing a fantastic job, a great job.
2 weeks later, President Jair Bolsonaro's communications director tested positive for coronavirus after a meeting with President Trump in Florida.
It's a great honor to have the President of Brazil.
1 month after the first confirmed case in Brazil, Dória mandates the closure of non-essential businesses.
Quarentena aos 645 municípios do estado de São Paulo.
Other states follow suit. 3 days later, the announcement.
Algumas poucas autoridades, estaduais e municipais, devem abandonar o conceito de terra arrasada, a proibição de transportes, o fechamento de comércio e o confinamento em massa.
Bang on a can protests are heard across Brazil. The country stands divided. Several state governors heed scientific advice and tell people to stay home to save lives. Vaccination is rolled out while the country's outbreak is at its peak. Manaus is the capital of the state of Amazonas. The city of 2 million lost control of the fight against the virus. In April last year, the world watched as bulldozers dug mass graves in the city while the local health system collapsed. Fast forward to January 2021. The second wave of COVID hit Manaus harder than the first. Hospitals' overcapacity forced people to go in search of air tanks to save their loved ones.
Vai assim, é?
Marcel is a religious leader and politician who, since the beginning of the pandemic, has dedicated his time to saving lives.
Em abril eu já tive Covid. Deus me abençoou que eu fui curado rápido e eu continuei. Continuei o trabalho e estou até agora. Quando a gente pensou que já tinha vencido ano passado, a gente viu algo pior, mais monstruoso agora que nós estamos enfrentando.
He delivers oxygen tanks.
Cada cilindro é uma vida, é uma pessoa, é assim que eu trato esse cilindro. Sua mãe está precisando?
He organizes the effort through social media.
Amanhece, entardece, anoitece, madrugada, socorrendo as pessoas.
It costs over $100 to refill a tank.
Mas eu já paguei R$2.000 na rua. 2.000? O que é uma vida? O que é 2.000 numa vida?
Marcel rushes to help a woman whose air is about to run out. A lot of times, his arrival is the last hope.
O Senhor é o meu pastor e nada me faltará. Aleluia! Aquela senhora estava profundamente paralisada. Eu orei por ela, conversei com ela, sorria. Ela começou a rir, tal. A saturação dela, sem o balão de oxigênio, foi a 94. Então ela estava sendo morta pelo pavor, por ela estar com a doença. Cura! Eu queria ser 1.000 pessoas para estender a mão e salvar essa gente.
Rodrigo, an emergency doctor in Manaus, struggles to find beds in hospitals.
Não ter onde colocar paciente. A gente já trabalhou sempre no limite da lotação, mas chegar a uma situação de a gente chegar na ambulância, no pronto-socorro, e o pronto-socorro está, entre aspas, de portas fechadas, isso nunca aconteceu. Às vezes a gente tem que peregrinar 3, 4 pronto-socorro atrás de um local que pudesse receber de forma adequada o paciente. Isso aí eu nunca vivenciei.
The patient's demographics have also changed.
A gente tem pego muito pacientes jovens, não que os idosos não estejam adoecendo, também estão, mas na primeira fase a gente não viu tantos pacientes jovens, a gente já chegou a atender pacientes de 18, na faixa entre 20 e 50 anos tem sido a sua grande maioria.
By the end of February, approximately 8,000 people had died in Manaus due to COVID-19. The city had to resort to building vertical graveyards as so many citizens died of asphyxiation. Meanwhile, scientists are trying to map the cause of the spike in the city. They are looking into the new Brazil variant, also known as P1.
We believe the P1 is one of those causes, but we cannot forget that we had Christmas and a New Year party and a lot of people come together. We were expecting an increase in the number of cases, but not such an increase.
Dr. Felipe Naveca, a researcher in Manaus, has helped to sequence the virus genome. Evidence is mounting that having COVID-19 may not protect people against reinfection with some of the new variants.
It seems we have variants with increased transmissibility, so we have to be more careful than we were in the past. It's really hard to block P1 if it is not already widespread in Brazil.
Coronavirus has killed close to 1,000 indigenous people. Nurse Wanda Ortega was the first person vaccinated in the state of Amazonas. She's a volunteer at Parque das Tribos, or Park of Tribes. This community in the outskirts of Manaus is home to 700 families of 35 different indigenous groups.
A nossa comunidade está extremamente afetada novamente.
Wanda helped to build a support unit to treat the indigenous people in the community.
A gente iniciou uma campanha nas redes sociais e essa campanha ganhou muita força. Chegou a doação de oxigênio, doação de redes, de alimento, de capote, de proteção, máscara, luva para a gente.
11 health professionals of indigenous background care for their relatives.
Eles não querem ir para o hospital de jeito nenhum. Eles morrem de medo de hospital. Nossos parentes vivem muito coletivamente e ficar ausente dos seus parentes é uma coisa muito cruel para nós enquanto indígenas. A gente vive muito junto. Aqui ele está sendo cuidado com as nossas medicinas tradicionais, que as mulheres que detêm esse conhecimento das ervas preparam e levam para a unidade. E aí também a gente entra com as medicações orientadas pelos médicos e a gente vai cuidando dos nossos parentes de maneira que eles se sintam confortados, respeitados.
Brazil's health minister, Eduardo Pazuello, admitted that he was warned about the shortage of oxygen in Manaus, but only acted on it days later. Pazuello is under investigation over his handling of the COVID-19 crisis in the Amazonas state. Eventually, the federal government shipped oxygen to Manaus and transferred hundreds of coronavirus patients to be treated in other cities. It's been reported that on his trip to Manaus, Pazuello encouraged doctors to treat COVID-19 with hydroxychloroquine. He denies it.
A tal da cloroquina.
But throughout the pandemic, President Bolsonaro has consistently pushed for its use.
Estou tomando aqui a terceira dose da hidroxicloroquina.
The Brazilian government bought millions of doses of chloroquine, and chloroquine didn't save nobody. Even is a risk if you consume chloroquine without medical prescription.
By the end of February, approximately 6 million people were vaccinated against COVID-19 in Brazil, about 3% of the 210 million population. Sao Paulo state-run Butantan Institute, the largest producer of vaccines in South America, is manufacturing Coronavac with raw materials sent from China. According to Butantan's director, Dimas Covas, 90% of COVID-19 vaccines applied in Brazil today are from the institute.
Butantan tem em compromisso com o Ministério da Saúde 100 milhões de doses e vamos entregar essas doses até o mês de setembro desse ano. Poderá ocorrer pedidos adicionais, estamos preparados para fornecer.
The federal government's bet on a single vaccine, the Oxford AstraZeneca from Britain, backfired.
Esse acordo com a AstraZeneca foi feito lá no meio do ano passado e que também deveria ter incluído outras vacinas, né? Mas de uma forma imprevidente, não foi feito essa previsão e mesmo com relação à vacina do Butantan Sinovac, houve aí na realidade houve uma desconfiança muito grande que acabou atrasando de forma considerável a introdução da vacinação no Brasil.
We offer to the federal government many times. We are losing more than 1,000 lives every day in Brazil. And the federal government spent 2.5 months to decide to buy a vaccine that we have on hands.
In September, Bolsonaro didn't answer Pfizer's offer of 70 million doses of its vaccine.
Na Pfizer, está bem claro lá no contrato, nós não nos responsabilizamos por qualquer efeito colateral.
Citizens will not be forced to take the vaccine, but municipalities may impose measures for making vaccination mandatory. Bolsonaro has said he will not take the vaccine.
Eu já tive o vírus. Eu já tenho anticorpos. Para que tomar vacina de novo?
President Bolsonaro's approval has taken a hit, and yet still roughly 30% of Brazilians give his policies high marks. People across the country continue to protest restrictions that some states have put into place to contain the spread of the virus.
A ação do Ministério ela precisa ser reforçada, o Ministério precisa se preparar e se planejar melhor para poder enfrentar o que vem pela frente. Essa segunda onda tem um potencial maior do que o da primeira onda. Nesse momento, o combate tem sido muito heterogêneo.
The Butantan Institute is evaluating its vaccination impact by immunizing the entire adult population of Serrana, a town of 45,000 in the state of Sao Paulo. About 30,000 people will get the Coronavac. Results of the study will be published in the next few months. Butantan is also building a new factory to produce vaccines 100% made in Brazil by 2022.
A capacidade prevista dessa fábrica é de 100 milhões de doses por ano, que é um quantitativo suficiente para o atendimento do Brasil, né, e, eventualmente, para o atendimento aqui dos países vizinhos nossos.
The raw materials for the vaccines are arriving in Brazil little by little. At this pace, it could take years to vaccinate Brazil's entire population. In the meantime, people across the country are relying on solidarity to breathe and survive.